The reason we conducted the study was that, past second and third line treatment for relapsed and refractory diffuse large B-cell, there's really an expanded number of treatment options for these patients. And so a lot of these treatment options are preference sensitive. So we really wanted to conduct this study to explore the potential of implementing shared decision making in this space, just to see, whether that would be helpful for patients. And so the study that we conducted semi-structured interviews by recruiting 14 patients with RR DLBCL and 8 caregivers, and the caregivers and the patients were linked, so we recruited them. And then the physicians, we recruited 8 oncologists, and 6 of them were community-based oncologists, and 2 of them were oncologists from academic or large health system settings. But the oncologists were not linked with any of the patients, so they weren't the treating physician of any patient. So essentially what we did was we conducted this study to assess, one, what are the preferences and values of patients and caregivers that impact their involvement in treatment decision-making, and what are their perceptions of what their involvement in treatment decision-making looks like. And then also looking around current caregiver and physician practices around shared decision-making in RR DLBCL, as well as, what are some things that patients or caregivers wish that they had along the treatment pathway. And so what we found was that, 71% of our patients, along with 38% of the caregivers we interviewed, perceived that they didn't really have an option to be involved or to express their preferences during the treatment planning process, because their physicians had communicated that there was a standard of care or treatment pathway that they were following. And what we also found was that patients noted that they really valued their caregivers' involvement in treatment decision-making, either as, a second pair of ears or as something that could help them, ask additional questions during the treatment planning process. But what we found was that caregivers don't really feel equipped to be able to take on that role, or there aren't really external resources that caregivers can rely on that explain to them what their role might look like in the treatment planning process, as well as what potential outcomes might be past first line or second line treatment. And what we also found was, caregivers and physicians, or not caregivers and patients, they noted that there were some things that they would have liked or would have wished that their oncologist would have done. So for example, we heard that 29% of our patients felt that their oncologist didn't really talk about issues that would be pertinent for young adults. So for example, the risk of permanent infertility due to stem cell transplant, 2 of our patients noted that that wasn't really discussed with them as a part of their treatment planning process. And then as well, we heard from some of our patients that their physicians weren't really equipped to address things that were related to their treatment, but maybe were ancillary related. So for example, mental health supports or nutrition supports or ways to relieve their symptoms related to neutropenia treatment. And so I thought those were some things that were really interesting that came out of our study.